Hi, my name is Gabriel Ling. Today I would like to share with you a study titled The COVID-19 Pandemic Situation in Malaysia, Lessons Learned from the Perspective of Population Density. As an introduction, Malaysia has undergone several major waves of COVID-19 outbreaks since March 2020. Based on the literature review, we believe that there are many factors affecting or influencing COVID-19 severity, and one of them is population density. And most often contradictory, population density still may exert certain degree of impacts on the COVID-19 severity. So the question is posed here, whether or not population density is associated with the number of COVID-19 cases in Malaysia cities. This study is more of non-pharmaceutical intervention. So we use this approach to offer probably a more interesting and insightful view to policymakers through population density. So the objective here is to ascertain the weightage or significance of population density as a factor in this COVID-19 severity in terms of transmission and cumulative cases. So it is hypothesized that high population density is associated with high severity of COVID-19 cases, both cumulative cases and infection rates. In terms of data collections, both variables, independent and dependent, were collected from the respective authorities. As for population density of 149 districts, the data were gathered from 2010 population census, whereas for cumulative COVID-19 and infection rate cases of COVID-19 cases, they were gathered or obtained from Malaysia Ministry of Health official websites. The data were covered between 19 January 2020 and 31st December 2020. The result, based on this data type and the sample size, it is believed that Pearson correlation was used, which is considered a parametric approach. And as a rule of thumb, it shows as below. And to have a better understanding and explanation of the results, a linear regression was employed too, with the R-square value that is helpful to explain the variance or variability in the response data, in this case COVID-19 severity. Now, the result shows that there is a strong positive correlation between population density and cumulative cases with R value of 0.64. And in terms of R square, it can approximately explain 42% of COVID-19 cumulative cases. Whereas for population density and COVID-19 infection rates, the R square, the R value is 0.216. It is still considered moderate correlation. And in terms of R square, it only explains approximately 5% of the COVID-19 infection rates, which is still quite substantial and quite important to be taken into account in designing and planning in terms of policy making. Now, there are two primary ways to mitigate the COVID-19 infection. One is self-contained urban planning, whereby it is more preferable to propose or plan mixed development with a mixed land use, so that more facilities around in the respective cities without having travel to other cities, and that kind of control the spread or transmission. Second is managing the crowding risks in dense areas. For example, maybe reduce the employees or workers working at the same time in that particular area. In conclusion, there are several key takeaways. It is quite evident that in Malaysia, population density plays an important role that affects is associated with the COVID-19 cases severity. And for the urban planning approach, we believe that minimized volume of necessary trans-district travel can be minimized if we have a proper planning, and by doing that, it may also reduce crowding risks at workplaces. However, it must be noted that aside from population density, there are other factors need to be taken into account, and proper revisitation of planning is needed to make cities more resilient against future outbreaks. Thank you very much.